Let's stick to Victoria though, because the Sunraysia Daily, it's not a paper that we touch on regularly, and I think we should. That's on me. But I guess following what's happened with the Victorian budget today, it's important to focus on what's happening outside of the 3000 postcode. And the headline tomorrow is Mildura Hospital snub. Mildura has missed out on its big ticket item in the Victorian government's 2022-23 budget, funding for a new Mildura Base Public Hospital. The Liberal Party last month pledged to put up to $750 million aside for a new hospital if elected at this November's state election, and there were hopes that the Andrews government would either match or increase that funding in Tuesday's budget. Liv, with the fact that so many people, specifically in Victoria, decided to either make a tree change or a sea change during, those 100 plus days of lockdown with COVID and the pandemic, surely they'd start to pay attention to people that are living out in those more regional and remote areas as they coast towards their own state election.
Absolutely. And this issue of the inavailability of, or lack of availability rather, of GPs, doctors, medical services in the regions is massive. And I was finding that when I was out on the hustings with Labor leader Anthony Albanese a couple of weeks ago when I was on the bus. And we were travelling around Tasmania, we went to Queensland, and when you're just speaking to punters on the street, they often mentioned it's taking weeks to get a GP appointment. So I totally understand the frustration that Mildura Hospital is facing, and especially when they were expecting this funding. The reality is these regional centres are under enormous pressure because the population's increased, and unfortunately they don't have the staffing or the funding to meet the needs of their patients.